much for coming.
All right. Welcome, everybody. Those of you who don't know me, my name is John Lotz. I'm the Director of Career Services here, and we are pleased to welcome our guests here from IU Health. I'm going to let you all introduce yourselves in just a minute. But continuing the topic that we've already, begun, obviously, and will continue to expand upon, and that is how how AI is being integrated into the workforce in different capacities. And what we all need to do as professionals and as, graduating students to ensure that we're prepared to succeed in the environment with those changing expectations and the ever-evolving landscape. So, without further ado, I'm gonna turn it over to you both to introduce yourselves.
Thank you. I'm Sue Lawhead. I'm the Executive Director of our campus recruiting area and talent acquisition. So I bring an HR lens to the space.
I'm Jeremy Rogers. I'm Vice President of Digital Marketing Experience at IU Health. I've been with the system for about 10 years. My team supports any patient-facing interaction we have digitally, so across the entire customer journey. You can imagine there's a lot happening AI adjacent nowadays for our team.
Awesome, very good. Okay, so we're gonna get them started with a few questions that I had prepared in advance. But I also think it's important that you all have an opportunity to ask about some of the things that you've thought about or that you might be concerned about. So we're gonna make sure we have time for you all to ask some questions as well. Sound good? Okay, great. All right, so let's get started with, so while clinical AI, right, often dominates the headlines, the business of healthcare is obviously being transformed just as rapidly. So from your specific leadership lens, what are you seeing as the most significant benefits of using AI thus far?
Go for it, Sue, please.
So I sit in the hiring space. So when you think about so many areas in healthcare have shortages. So the idea of being one of the healthiest systems, in the country, or healthiest states in the country really means it starts with me. The work I'm doing on campus to grow our pipelines to then, become future nurses, future imaging specialists. I could go on and on. So from our lens, the faster we can get through to the right candidate and get you into that role, the better. So we use AI in this space from our work from application all the way through hire. So ideally, it allows us to look at a more diverse pool of candidates. So we are looking at how to get to that best candidate. We're able to spend more time talking with you because the AI did the work of screening things out that, might have been a knockout, for example, if you didn't have enough years of experience for a particular role. So it's pretty exciting to see how, it allows us to be actually more human facing in that sense because we're not spending so much time in the paper.
I love that. I would echo that from my side. I sit on our AI governance committee. We formed that about 4 years ago. You can imagine there's been an explosion of requests across the health system for different types of point solution AI. Where I've seen the most value to date is really frankly more on the back office, things like clinical support, revenue cycle, think billing and coding, all the administrative layer of healthcare. That automation has been really powerful, to Sue's point, to unlock the human capacity. So take some of that grunt work, drudgery off of a team member, let them focus on the highest part of their role. A lot of benefits there. We've been very careful around patient-facing AI. I mean, there's a lot of snake oil sales around, hey, you should deploy an AI that's in front of your patients. We've been very careful because there's a lot of trust issues or lack of trust. There are patients who are scared of their data being leveraged or exfiltrated via AI. So we think there's value there. We've done things like chatbots and things like that, but it's really been very focused on where can we add value for the patient and add value for our care teams. And so far, again, that's been more on the back office than the front office, if that makes sense.
Interesting. I've got an older daughter who's a nurse, and
We don't use older.
and also a wife who's a physical therapist, and they work in a variety of clinical settings. One of the things that I hear a lot of talk about it, because I know how time-consuming the documentation part is, and when you're measured on productivity and everything else, especially on the therapy side of the equation. I've heard a lot of talk about AI being used, AI assistive platforms or whatever to be used for documentation. Is that something that you're also looking at?
It is. So things like ambient listening, we've deployed for hundreds, actually over 1,000 providers now, where it's helping them scribe both in clinic and after clinic. You've heard the term pajama time. Many of our providers use pajama time, weekends, evenings to do documentation. That scribe really helps speed up that workflow. Again, you've got to be careful because there are patients who are worried about, is there an AI listening to me? We have situations where today the patient may bring their own AI assistant to the clinical exam room too, so there's competing AI platforms. But absolutely, ambient listening is a great use case. We're doing more with things like fall prevention. Imagine an inpatient room where there's a camera, and we used to have a sitter or human being watching them. Now with AI, it can watch and say, oh, this patient's about to try to get out of bed, throw an alarm, things like that. It's really been very powerful for us.
Awesome. Overall, and you already kind of touched on this a little bit, what has been your approach to then patient-facing AI in helping them overcome some of the hesitance, the reticence that they might have?
Yeah, so I think to Sue's point earlier, it's really about, it's the human touch. We can't, I would argue healthcare is one of the few brands that's really totally based upon human-to-human interaction. It's that patient-provider connection and relationship. We cannot do anything that jeopardizes that relationship. So it's been very careful around what is the value, what is the use case, what is the need, and is AI the right solution? We don't want to deploy AI for the sake of AI or the sake of technology. So I think it's early days. We had everyone out of the woodworks asking for, hey, this vendor has their AI, that vendor has their AI, but they didn't fit well together like in the patient journey. So finding ways to, again, plug it in a natural, intuitive, seamless experience for the patient. Early it was chat around like scheduling. If you tried to call to schedule, we do a lot of online scheduling, but there's still many specialties you have to pick up the phone. Our call center's not open 24 hours a day, 7 days a week. So things like conversational chat to schedule on evenings or weekends, patients love those things. It's easy, we can present them with few options, press 1 for 9 a.m., 2 for 10 a.m. That's easy, it's low, it's not provocative. That's been very impactful. We're in the middle of transitioning our electronic health record platform. We've already approved some other use cases where it'll help patients summarize their clinical records. So you understand these results are very difficult. Many patients will take and copy and paste a summary into their own AI. We want to make that more native in our own platform. So we're doing summarization, helping them ask questions. Again, we're early days, but there's a lot of potential in areas like that.
Cool.
From an HR perspective, I think something interesting about that is if you think about, like, I'm a person, when someone calls me, I'm like, why are you calling me? You could have texted me. So having this opportunity, if you prefer to use electronics over people, that's an option too. So it's kind of a comfort zone too for people who, kind of grown up in technology where it's very normal to just do things through their phone.
Yeah. I'm gonna go off script just a little bit here because something that I think probably a lot of people worry about. What are some of the concerns that some of your clinicians and care providers have expressed with regard to how AI is transforming how we do business in healthcare?
I would say to what I mentioned earlier, there's a fear around putting a wedge in between the patient and their care team. It can't do that. You gotta have the human interaction. There are some concerns around certain types of automation. So for example, like radiology, how much automation do we want to do? We're not looking to displace human beings. We're looking to make human beings more effective, more engaging, but there's still risk around that. I will tell you, a couple years ago, there were folks who would say, hey, we'll build you a chatbot AI doctor in a box. We'll do all your diagnosis. And we're like, time out. No, thank you. That's not the business that we're in. But there are still lots of worries about where this thing may go longer term because we're still so early in the journey.
And then maintaining trust, that's always at the center of everything we do. So.
And how do you do that from an
I
HR
think
standpoint?
being transparent, I think being forward, I think we're known as an organization who does look for advancements in every capacity, whether it's in marketing, HR, or a clinical space. So I think also our reputation for our quality of service, I think that carries over from our employment brand to our patient care and on. So I think it's something we think about at every stage. So you start off in my world, as a candidate, I think you probably are a patient as well, right? So, we're all patients. We work for this very system that cares for our own families, right? So it's something we just take seriously from every stage, and there's always something focused around you, the individual.
So spinning that around and looking at it through a more positive lens, right? What are some examples of how clinicians are really benefiting from some of the things that we're doing, some of the integration that we're seeing with AI?
I mentioned earlier pajama time. Our goal is to reduce that. It probably will never become zero, but dramatically reduce it is one area. I think about inbox fatigue. You all may know during the pandemic there was a flood of patients just sending messages to care teams, voicemail, portal messages, text messages. The volume we're seeing today is continued to grow, and we just don't have the workforce to respond to that. I mean, before the pandemic, we would tell people your provider will typically get back to you in 1 to 2 days. We can't say that nowadays. And so using these technologies to kind of redirect, answer the question up front. If we already know the data's already there, we'll answer it. But I think reducing that and letting the providers focus on those patients who need the response immediately, the urgency, I see a lot of value there.
I'd say the administrative piece for them, taking away the things like the scribe we mentioned earlier, being able to document processes easily, so they can again focus on the patient and not so much time spent doing the other task-like things.
Before I get to this next question, and because I kind of want to get a lay of the land in terms of who we have with us today. How many of you are in either healthcare or something healthcare and wellness adjacent? Okay. Business? Anybody more on the business side of things? Tech? None of our techies, huh? They already think they've got all the answers. Right? Okay. Good. That helps, because this next question is probably a good one, and probably one that a lot of you are really thinking about. So for students graduating today, the students that we're preparing for this ever-evolving landscape, this new workforce, right? What is one piece of advice that you have for them to help them remain competitive and AI fluent as they begin their careers? What are some things, and it could be more than one, right? What are some things that they could or should be doing to kind of prepare themselves to make that transition?
From my lens, I think you're already coming out of a tech-inspired university. You probably are pretty tech savvy growing up in this space. So I would say continue to be curious and look for ways to educate. We have what we call the Guild, which is a place you can go to advance your education or just pick up new skills. So I would utilize the Guild. A lot of our folks do that to go and advance their degrees, to learn a skill. Like I had a member on my team who hadn't used Excel before, so we had her take the Excel course. So there's just a plethora of opportunity through the Guild to just advance and learn and grow. And because AI is becoming such a big part of our space, we've got options in there. We also host a lot of like lunch and learns around how AI is working in our space. So you can join those and learn. You can be a part of committees that help make decisions around your subject matter expertise. I'm here as HR. We've got marketing, right? We've got clinical groups who come in and speak about this. We also, use that information for our recruitment. It's a big draw if you're in imaging, for example, and you get to use the state-of-the-art technology, or going into one of our new hospitals like downtown or Fort Wayne, where it's literally brand new. technology and neatly designed by our own people. So it's an exciting time to be entering into healthcare.
Yeah, I totally agree. I talk to my team a lot in terms of the cliche where AI won't replace you, but humans who use AI better than you may replace you.
It's a
And so I
great way
think
to
you,
say that.
Yeah.
you all are coming here at a good time because I think during your time in college, you've already seen so much change. I think this landscape, even 3-4 years ago, totally different. So I think that's an advantage you have. Think about folks who are more incumbent in their career. They're a bit more rigid. They're having to learn these things on the fly. You're gonna come in day one being native to that environment, which I think is a big benefit you have. I think to Sue's point, you've got to truly be a lifelong learner. I think the way things look today, tomorrow they're gonna look different. I mean, the AI we're talking about, it's never going to get worse than it is today. It's gonna keep getting better. And so I think having that mindset, be open, be flexible, try to have optionality. The old Mike Tyson saying, everybody has a plan till you get punched in the face. You're gonna get punched in the face, and so it's how you react to it. But I think it's an exciting time for you, I really do.
Jeremy brings up a really good point, and it's something that I mention just about every time I host one of these. And that is, if you are using AI with intentionality and strategically, right? That means strategically, not at the expense of your critical thinking, but in conjunction with your critical thinking. You're gonna be able to do amazing things. You're gonna be able to do things that you probably never could have done before. If, to your point, you're using it lazily and it just becomes kind of a Google cheat code, there will be people who are using it more effectively, and then we probably won't need you as much, right? So you really have to be very conscious about how you're using it and just accept the fact that whether we like it or not, because there are obviously things about it we probably don't like. It's Pandora's box. It's not going anywhere anytime soon, so we have to be able to leverage the tools to help advance our careers, because fighting against it isn't gonna get you anywhere. I'm glad, Sue, I'm glad you brought up the Guild, because we also just, for those of you who are obviously still students here, we have Coursera Academy, where you can also earn, micro-credentials in a variety of different things, including AI essentials and prompt engineering and things like that, that'll help you, learn how to use the tools perhaps more efficiently than you do now. So, good. Questions from you all. This is a great opportunity for you to, ask some questions and express some concerns that you may have, because, I think it is a double-edged sword. There are great things about it, there are really concerning things about it, and I think we all recognize that. So ask anything. This is a perfect opportunity and a safe space for you to ask whatever is on your mind. Yeah, Jeff.
You mentioned scribes, in particular. I absolutely see the benefit of using AI, and not just a scribe perspective. And I have a son who also does intervention radiology, and he uses examples of how they can't figure it out, where is it at? And it's by using AI, bingo, they found it, right? But there's also another concerns I have, so even locally here, we use a lot of medical scribes. And just recently, depends on who comes in as a director, they feel very comfortable with AI. We've now at the loss, one of the comments you made is that AI will not replace you. It's the people with AI. Well, in this situation, no, we do have a lot of individuals that can describe people. So it's the touch point, it's the learning, especially at the undergraduate level. They're using the AI as a means of saving money, saving time, so forth. Again, I understand the importance of all this, especially if I have a provider. If I'm gonna tell you you're gonna get a scribe, or I'm gonna be able to keep you and attract you, so forth. But what we're also then missing out on is the other soft side of the learning opportunities for our students. So now instead of having 1 or 2 medical scribes with AI, we just lost out on 15 learning opportunities for students to be exposed to what healthcare is and having this vision and passion of that idea. Make sense?
It does.
What's the answer to that? What do we do?
I'm not sure I'm qualified to answer that, honestly. I'll say what I've seen in my time at about a decade, like our velocity around scribes changed before AI. Like just from a cost perspective, we did not have as many scribes as we used to. I think some of that was provider preference. From what I've heard, newer graduate providers, they're just not, that their workflow is not as scribe dependent as some of those who are maybe more mature in their practice. I've seen that as well. What I worry about, frankly, is some of the health equity and things like we serve all types of patient populations. There's a language services component of the scribing that AI today legally cannot solve that for you. You have to have a certified interpreter in those situations. So I think there's a collision between those two situations that we've got to solve for.
Excellent, we didn't think about that one.
From an HR lens, it's how can we recreate opportunity for those people who are losing it? Where can we use adjacent skill sets to, our job is to develop people from hire to retire. So we have to constantly evolve to say, what do we do with this population if this changes, if this changes? That's something we're thinking about in our workforce planning at all times, from TA to the clinical space.
Thank you.
Other questions?
I actually had a question regarding, you mentioned your core values trust. I didn't know if you dealt with a situation or experience of where that's been a challenge to continue building that trust with AI increasing, and so.
I think in my space, it's probably an easy one. I think people think, did the robot close me out, or did an actual recruiter look at my resume? I think that's a question we hear all the time, and I tell people, my team, I'm the campus leader, so every student that enters an application into our system talks to a recruiter. You are screened, every single one. So it's important to us to talk to you because what opportunity might not be there for you today may be there tomorrow. So we want to make sure we're getting you into our pipeline, into our system so that we can stay in touch with you until it is the right time, if it isn't that initial time. So.
I love that example. What I've seen, we've done a lot of our own first party and third party research. There are patient populations who are just very hesitant about how AI could be weaponized against them. You think from like an insurance perspective or a risk perspective, people are worried about that. We've had examples where patients, they bring their own AI, but they want to record a provider. So we actually had to create a policy around recording your care team. We allow it, but you must disclose. Because again, with deep fakes nowadays and the way that information can be used, a lot of our care teams are worried about how that may come back to haunt them down the road. So I think because we're so early in this, your mind tends to wander to some of the negative outcomes. I think there's clearly a net benefit, but in those corner cases, there's risk that we have to solve for too. We just haven't gotten all the way there yet though.
Thank you.
Before implementing new AI tools in clinical spaces, how is IU Health connecting with providers to assess what will truly be beneficial or valuable to them?
Yeah, I love that question. We are lucky because we have an abundance of governance. So like I mentioned, the AI committee, providers are on that committee, and those requests that we get come from the individual units or departments or specialties. So part of our intake process is really understanding what is the need, what is the benefit, who is the clinical champion, and then they have to actually co-present with the vendor or partner on all these things in front of the committee. We have clinicians on the committee, we have lawyers on the committee, we have medical ethicists that are on the committee, so that the questions that we raise are really, really deep. I'll give you an example. There was one around automating a perioperative journey. So we had an AI that could actually outreach to a patient the day before surgery and ask about, are you taking your medication? Have you prepped for your surgery? Seems pretty benign, AI could do that. Well, the question came up, what happens if during that conversation the patient's nationality or citizenship status is mentioned? Because let's say they're speaking a different language, the AI would know what their dialect was. If that gets written into their medical record, could that fact, that their residency, their citizenship, could that then be leveraged against them? Could we be subpoenaed? And the answer is yes, potentially. So that kind of ethical question got surfaced in the AI committee before it got too far along. So just things like that happen literally. We meet every week. Those questions come up every single week.
You kind of talked about a little bit about translating and different languages, and you kind of mentioned that that's not
allowed to be used. Can you kind of dive into that a little bit
Happy
more?
to. So there are federal requirements around clinical translations. We can very easily translate like the marketing content my team supports, things like that. But the moment it becomes clinical in nature, you have to have a certified human interpreter do the translation. So today, typically, if a patient leaves a message, we can dynamically translate that because they're asking a question of us. But if their provider is giving them medical advice or medical results, they can't do that automatically. Years ago, we knew we had providers who would use Google Translate, super easy, copy paste, get a translation. Legally and from a compliance perspective, that's not allowed here in the US yet. I understand there are some vendors who are looking to get FDA approval for that, but there's today not a single approved vendor that can do that automatically. I think that'll change, but we're still not there yet.
Yeah, and I would add to that, I mean, not only, obviously in anything where we're dealing with human interactions, I mean, we want that human in the loop, right? But even when we talk about data analysis and things along those lines, or you're creating a new resume using an AI tool or whatever it might be, you always have to have that human in the loop. And the reason I say that is because AI is, especially when we're talking about, I mean, there are specific platforms obviously that you all are using in a clinical setting. But the AI, the way we typically use it, when we're talking about some of the LLMs and everything else, we were talking about this earlier today. Do you know where they get a lot of their information? I would say a majority of their information. You'd like to think that it's being pulled from a lot of legitimate sources, right? Various publications, EBSCOhost, where you're pulling in scholarly articles, so on and so forth. The biggest source of information is based on upvotes from Reddit.
Yep.
Do you think that's viable? Do you think that's, in some cases it is, right? I mean, some of that information is good, just like Wikipedia. But there's a reason we don't let you use Wikipedia when you're citing sources in an essay that you're writing, right? Because we don't know. That is not fully vetted. And so you have to be careful. I've done interviews where people don't know what is on their own resume. It's another reason why you want to keep the human in the loop, and you being the human who needs to be in that loop, right? Because a lot of people just trust whatever AI is putting out there, and they don't even know what it's produced. So that is such an important part. Again, you want to use the tool and you want to use it to improve your efficiencies, your ideation, your productivity, but you don't want to use it at the expense of your own critical thinking.
John, one more example on translation services. We also serve a large population of Amish patients who speak many of the Pennsylvania Dutch. There's a debate religiously, the religious dogma. If we use an AI to translate and then give the content to them, is that violating their religious beliefs? We don't know that yet. That's still being debated. So it's just super interesting space.
We also apply that in the sense of hiring and onboarding. You know, if you think about the safety of an individual, understanding a lab or tools or things like that. So it's across all the board.
Good questions. Good questions. Any other questions? Okay, I'm gonna ask you all a question and then you give the answer. Let's pose some questions to you all. Another thing we were talking about earlier today, one of the things I love about Gen Z, I kind of dig that you all are going retro in some ways, right? People are wanting to unplug a little bit more. People are listening to vinyl instead of just streaming all their music. I love that, and I think there's a reason behind that, right? I think there's not only saturation with technology, but I also think there are those inherent concerns associated with technology kind of taking over who we are and our opportunities. What are your biggest concerns right now as you look ahead to, a professional career after graduation? Yeah.
I know I recently was concerned just because, like we were saying before, AI is really looked down upon when it comes to like different things. So I wasn't sure, like, okay, AI should be incorporated in, my career and things that I want to do. And I actually was at another seminar, and they were basically saying that they're not really so-called like frowned upon AI. They want, like you said before, just to see how you use it, and they want to see how you use it and how it would benefit the company, if that makes sense. So that was one of the things I was a little concerned about.
What other concerns?
I am a year away from graduating physical therapy, and productivity is a big concern, especially when looking for like a future job. So if there is some component of like AI helping as a scribe, that seems really beneficial.
Yeah.
But then I worry about, okay, who's in charge of like productivity? Are they gonna use that and say, okay, now you have to see double your patients or something like that? So is it really gonna be helpful?
wouldn't expect
No.
I know, it's an
You know-
exaggeration,
you know,
but.
You are a wise, you are a wise professional. Yes, there will be some of that. Because at the end of the day, these are businesses, right? Healthcare is, sometimes we think of healthcare in terms of just patient care, right? Helping people and doing whatever it is we're doing to provide. Healthcare is the biggest business out there. There is more opportunity in healthcare than just about than any other industry right now, currently. And it's really not even a close second. But because they are businesses, they are also profit-driven. And yes, there probably is a likelihood that you will see some of that.
I would add, so our director of patient experience is a practicing PT provider as well. He sits outside of my office, and we talk a lot about like his practice and things like that. I think PT, where you'd see the impact, is more on matching the right patient with the right provider, because we have PT specialization where whether it's OT or other types of therapy, oftentimes the first encounter, it may be a mismatch where what the patient is looking for is not really what that provider can treat for them. He talks a lot about how matching the right patient at the right time will actually create more efficiency and throughput in his practice potentially. So I think it's interesting.
Those of you who just joined us, thanks for coming. We've been talking a little bit about AI, a lot of the really good things that AI brings to not only the healthcare arena, but other opportunities it provides us in terms of improving our efficiencies and our productivity and all those good things. But we're also talking about some of the concerns. So even without context, those of you who came in, if you have any particular concerns, that's what we were talking about right now. Any particular concerns about how AI is being leveraged and how it might impact you professionally? I just wanted to make it available for you to ask questions too, if there's anything specific you wanted to walk away with here today.
How soon do you think our industry will actually turn over from using the dial tone touchpad for just scheduling appointments, 1 maybe 8 AM to as 9 AM for our example today?
Could you say that again?
Yeah, just a little louder.
So more about the industry and just how it will cross over, so the overlaps and just actually scheduling appointments. So per se, EEOC to nursing, healthcare, administration, and just AI and HR. So get AI and being in the space itself, and just to kind of see how well it might translate across the entire country.
Well, so not necessarily unique to healthcare, but a big benefit to AI is human bias. Sometimes a hiring leader might read a name and think something, right? It may not be negative all the time, but it might sway their decision. So AI won't do that, right? That name will have no bearing on the data that's in that resume. So there's some benefits that it brings to the table around fairness and diversity and really setting an equitable palette to select from. It's gonna raise skills up. We don't choose tools that rule talent out. We pick tools that raise talent up. So it brings talent. So if you're more qualified for a role, you're probably going to come up at the top of that list, allowing us to get to you faster and have that conversation to try and lock you in for that position. So the law drives everything we do. We work with the audit team to make sure our processes are set up properly so that the AI we input into it to manage that process works for us too. From application to screening to, we also use automated interview scheduling in our space as well. So being able to give you that personal touch to lock in, and we keep durations, so if you can imagine like, let's say you're in a situation where you may not have access to the internet, you might live off campus and say there's a storm and you can't get online, you've gotta come on campus to get here. What if we only posted that job one day and that was the day that storm hit? You don't have a chance at that job. So keeping jobs posted for multiple days allows people in their personal life, or if you're on a shift and you're working 4 in a row, you may not have the time to go look and see when that job was posted to try to apply. So we try to make sure that there's a slate that, that's open for a period of time. Like in my space, we keep our, we call it a pipeline, so that way it's posted all year round, so we don't miss talent. Typically, the only time we bring it down is for a couple of days to put a new one up, at the start of every semester, but it's critical and it's the baseline of all things that we do. And I would say that starts at Dennis on down, our CEO.
What I would add, you mentioned scheduling specifically, healthcare is still dominated by phone calls is the reality. Like we at IU Health take over 9 million inbound scheduling calls each year. That number will always be in the millions is the reality. We have patients, we talked about health equity, as much as we'd love to do online scheduling or SMS scheduling, there are patients who just won't do that. We do think though, looking at people around the country, there are systems who've deployed automation on top of like their phone trees where you still call in, but for like a low acuity encounter, like a primary care visit or annual wellness visit, that can be scheduled via automation. Like that's very simple. There are systems who've reduced that by, they've taken 30% of their inbound human calls and done that via chatbot, via voice bot. We'd like to shift more, a lot of our patients prefer text message scheduling, it's easy, but there are federal laws, there's a law called the TCPA which governs how many times we can text a patient each week. And for a high volume health system like us, we may be texting a patient 5, 6, 7 times. There's a risk around saturating that too, so there's a balance there. So I don't think it's ever gonna be zero, but we're gonna drive more volume that way over time, no doubt about it. Does that help?
Yes, sir. Thank you, Mel.
Time for one more question before I'm gonna ask you all
Uh-oh.
to hit us with one big recommendation. What you would suggest, what you would recommend our students can do to really level up and prepare themselves for the expectations beyond graduation. Before we get to that question, do we have one more from any of you? Yes.
I was wondering about so you talked about AI like kind of doing notes for clinicians, which I think is really helpful. But you also mentioned like how patients might use AI as well. I was wondering if you could go into more details to, I guess, what the goal of that would be, like whether it's just answering their questions or appointments.
Yeah, so I think it's twofold. So today we see patients will copy and paste from their portal and directly in ChatGPT, which we don't discourage that, but you all understand that data is not secure. Like that, they're training these third-party LLMs, and so we're trying to help educate. Like if you do that, there are risks since you're taking that risk. So by embedding those tools natively, it can be more compliant, and we can actually help recommend better information. That's one part of it. On the note piece, it's just the amount of data we throw off from a given clinical encounter. Many of these DPAR summaries are pages and pages and pages long. The average patient, they get overwhelmed, like they don't know, like if you have a portal, like you download a PDF, very few patients are gonna spend the time reading every single line of that. So these AI summarization features, it can help them flag what is the most important thing, what are my next steps, what's my care plan? Here in Indiana, for example, we try to produce our content to 4th grade reading level. Clinical content, it's impossible to produce that content at a 4th grade reading level, but an AI can definitely provide a pithy summary of that. And so just things like that I think you'll see a lot more of that in the years to come.
Yeah, that's another really good point. Obviously, because your data and your personal information is not necessarily protected, especially when you're using like the big LLMs. whether it's Gemini or Copilot or, you know, ChatGPT or whatever it might be. Even when I use some of those platforms for like data analysis or something like that, even your resume, right? Because it has personal information on it. Anything you don't want to be out there and available for anyone to be, you know, to be able to access, redact it. I mean, I can put in a spreadsheet and it'll do a great job in many cases of helping me to identify some of those key points, those key talking points that I want to focus on. But again, I'm gonna redact any of that real personal information that I would not want being accessed.
Because if you don't, it will be used to train that model.
Yeah.
It's your
Yeah.
data is they're the customer at that point, that's what they're training it with.
Absolutely. Okay, so final takeaway, what would be one really good recommendation you could share with the folks here today as far as, you know, something they could do to really prepare themselves to leverage, you know, the tools the way it's gonna help them be more successful?
I would say there's the obvious tools to get a job. So I'll jump to once you're employed. Utilize your career site, the internal site. If you plug in your profile information, the same AI that you can use externally is available internally. And it will put jobs in front of you that maybe you weren't aware that you might be interested in because of how you plugged in your personal information. It might open up opportunities to network with other groups that you might find interesting to think about your development. You know, one thing we do every year as a system is look at your goals as a professional development and then as personal development. So we as a leader will talk through that with you. Like right now I have a recruiter who was interested in the technology side of our work, so we've now created a role that allows her to focus on that. Isla in the back was formerly a recruiter on my team who now does all our event planning and uses it in that space. So there's lots of opportunity to use it to develop and kind of design your career over the course of your entire time with your organization. So I would say that would be the big one, is to, you know, really take advantage of those internal tools.
I love that. I'm gonna take a more philosophical approach. I've got 2 teenagers at home who are early in their career planning journey, so I have conversations with them what they wanna be when they grow up. I worry for them a little bit because it's a really hard time to be a teenager and there's so much coming at them. We talk a lot about, because they're encouraged to use AI every day in their school, which I love that, but to your point earlier, John, you can't use it to outsource your cognition. Like, it has to be a tool to help you be sharper and think more critically. That's my big worry, is that people are kind of walking away from critical thinking, which I think as a professional, that's my number one value, is being able to think critically, because things change so quickly. So that's my philosophical point. I think for you, where you sit, things are changing so quickly. Like, you've got to be flexible. You've got to have different pathways to explore. I think it's exciting, but if you get too rigid, you're risking going down a cul-de-sac or hitting a dead end. I think that's what I look at too. You know, I think there are ways to leverage these tools to be a force multiplier for you. Whether it, you know, we talk a lot about generative AI. I think the past year, the focus on agentic, the way you can find ways to automate your workflows, whether it's helping you do research. Like I have agents now that send me like updates every morning, like they've done research for me. I can plug those into my thinking, my planning, so it truly is a force multiplier. But frankly, if we came back and gave the same talk in 3 months, it'd be different. A year from now, who knows what we're gonna be talking about? So you've got to really embrace the fact that things are gonna change. And I think that mindset of being open to change is a unique differentiator for you, because there are people who just internally they get stuck and they like the way their job works today. They like what they learned in school. And when you're out in the real world, sometimes that's not the way things work. You've got to pivot, you've got to evolve. And so the earlier you can embrace that mindset and try to be a ball of clay that can be molded over time, I think that'll serve you well in your careers ahead.
That's such a great point. You know, I used to teach a lot of historical literature and things along those lines, and we talk about periods of time and periods of evolution, right? Technologically and otherwise, from the Industrial Revolution to computers to, you know, whatever. It's one of the reasons why, you know, we always talk about the importance of being lifelong learners. And that's still true today, but you have to be willing to pivot a lot faster because this evolution is occurring at light speed by comparison to all of those other segments that we look at historically. So just maintain that entrepreneurial spirit, maintain that innovative, intellectual curiosity, because it is gonna change rapidly. And the best thing we can do is just keep an open mind and stay with it. You know, learn as much as we can as we go, because those are the people who won't be left behind. Anything else before we let y'all go, because we're about at time here. All right, how about a hand for our thank you so much, we really appreciate it. And thank you all. If you haven't grabbed food, or even if you have, there's plenty out there, so please feel free to grab some more food, grab a drink on your way out, and thank you all for coming.
For having us.
Thank you. Good stuff. Be here. How is our ISU pipeline these days? Do we have a connection? That's awesome.
Good.
That's great.
Thank you so much.
Oh, good stuff. Went too boring.
Yes, yes.
Okay.